All right. Thanks for being here, everybody. Can everybody hear me okay? Perfect. We are going to talk about vaccine hesitancy. I have no disclosures. The objectives of this talk, first we'll review the current state of vaccine hesitancy in pediatrics. And then the most important part is talking about effective communication strategies to increase vaccine acceptance. And then lastly, I've got a whole bunch of cases at the end that are kind of common parent concerns. So I'm hopeful that we'll get to some of those. But do feel free to interrupt with questions or other things you want to talk about. Okay, so vaccines. Important to all of us here in the room. It's pretty much important to all children and every provider who cares for children. They work great. There's been a greater than 95% reduction in mortality from vaccine preventable diseases. They are cost effective. They are safe. They've studied millions of children and vaccines are safe. And they're routinely viewed as one of the greatest public health achievements of the 20th century. Essentially, between vaccines and clean water, it's how we keep children alive now. So obviously, vaccines are great. Everybody accepts them. Everyone's lining up at the door. No problems. I wish that were true. But unfortunately, there's lots of reasons kids don't get vaccines. One of the main reasons is vaccine hesitancy. The WHO definition is the reluctance or refusal to vaccinate despite the availability of vaccines. So I think it's really important to remember that vaccine hesitancy is a spectrum. So there's going to be some families that, kind of intend to get the vaccines, but have some questions. And then there's going to be people who have hesitancy against a specific vaccine. Then there's going to be people who are never, ever going to get a vaccine in their life. And this is all encompassed in this vaccine hesitancy. About 6% of parents are hesitant about routine childhood vaccines. And unfortunately, there are other vaccines where families tend to be more hesitant. So the ones that people tend to be more hesitant about are influenza vaccines, HPV vaccines, and COVID vaccines, which I'm sure is consistent with the experience that you all have had working with families. This is a map of COVID vaccine hesitancy across the US. Unfortunately, in Washington, we are in better shape than many places, but we do experience a lot of COVID vaccine hesitancy here. And they did a Pew study back in March of this year, which asked adults whether to compare the benefits of COVID vaccines compared to other childhood vaccines, specifically MMR. And there's, not surprisingly, a lot more hesitancy against COVID vaccines. Is vaccine hesitancy changing? I think that, it feels like it from people who are working in clinic. I don't know if that's been y'all's experience here. And there are some studies that support that it is changing. So this is a study that Doug Opel did, who's one of the pediatricians in Seattle, where they were already measuring vaccine hesitancy in clinic patients and parents, before the pandemic, and then the pandemic happened. So they had this great natural experiment to say, hey, what happened to these negative vaccine attitudes? And interestingly, what they found is initially with the pandemic onset, is they actually had a decrease in negative vaccine attitudes that unfortunately went back to where the baseline was as early as August of 2020. And then there was another study that measured parent attitudes about vaccines across the pandemic. So this went up till March 2022. And as you can see, while in the top two frames, it looked at what the positive attitudes about vaccines, and those stayed roughly the same. In the bottom two frames, the negative attitudes that child vaccines can lead to illness or death, or child vaccines have many known harmful side effects, both increased over the course of the pandemic. So I do think that we are seeing more vaccine hesitancy now than we were seeing, let's say, in like 2018, 2019. And the question is, how does that impact our vaccination rates? So unfortunately, this question is a little bit confounded by all the other barriers we saw to vaccination during COVID, specifically, limited visits in person, lack of staffing, and we're still trying to recover from a lot of those things. So this is a map of this is a graph of the childhood vaccination coverage for Washington State that's put out by the National Immunization Survey, or NIS, through the CDC. And this is looking at children who are 2 years old and whether they've received their whole 7 vaccine series. And as you can see, kind of prior to 2020, we were getting some improvement, and then we had a decline in 2021, which is likely a combination of access issues as well as this likely increase in vaccine hesitancy. I think it's really important when we see this number of 70% to remember that that's people who are missing one of this series. So that doesn't mean that they're missing all of them. That's a lot of kids. A lot of second Hep A's get missed based on the timelines, or they might be MMR vaccine hesitant, so they're missing that one, but have gotten the rest of them. And then this graph shows adolescent vaccine coverage for that same period. And again, you're seeing a slight decline in those 2021 numbers. I think there are two important things to think about with this graph. One is looking at HPV, which is the orange and the brown lines, and how far below the rates for meningococcal and Tdap are for HPV. And then the second is, I forgot what I was going to say. That's the main one that I wanted to point out. And then this is influenza vaccine coverage for children, so children under 17. Again, we see that slight decline in 2021, and it has been below the Healthy People 2030 target of 70% throughout. Again, this is a map of vaccine coverage in Washington State. So this is the proportion of kindergarten students who are up to date for the 2022-2023 school year, so about a year ago. Importantly, the vaccines that are required for school, vaccines are required for school in Washington State, which is a great way to get communities up to date on vaccines. The required vaccines are listed there. As you can see, they're not all of the CDC recommended vaccines are required for schools in Washington State, but having vaccines required for public schools can improve vaccine acceptance. You will see in the map that there is variability this is by county, so there is geographic variability to this, which puts communities in these lower vaccinated areas at higher risk for vaccine preventable disease outbreaks, as we have seen both in Washington and other states. Okay, so now what? What do we do about vaccine hesitancy? So we know it's a problem. We know that it's a spectrum, and there are a few effective evidence-based communication strategies that can help us improve vaccine acceptance for families. One thing that's really important is that you all are the front lines of this. You all are the important people. Every study that's ever been done of parents asking them where they want to get vaccine information, they always say their provider. You're the preferred source of vaccine information, most trusted. You can positively impact vaccine intentions and positively impact vaccine uptake. You know, I think it's really hard when we see families who are vaccine hesitant that it feels bad. It feels morally distressing to us because we know vaccines are good for children, that they save lives, that they prevent disease. So when a family is really hesitant, it can feel like we're not doing our job in helping these children. And that's not true. That's, you know, most families do accept vaccines. You know, there were some studies, including one out of Kaiser that was really nice, that looked at vaccine hesitancy over time, where they had a cohort of parents of newborns and followed them for the first 2 years. And they found that vaccine hesitancy in those families declined. So I think that remembering that today is not your only opportunity to provide vaccines for children, and that parents do trust what you say, and that will increase over time is really important. This study was done that looked at for parents who changed their minds about delaying or declining vaccines. So these were parents whose children were behind on their vaccines due to vaccine hesitancy, who then got caught up. And the number one reason that parents said that they changed their mind was they got information and assurances from their healthcare provider. Some general communication principles from the AAP and CDC are kind of all of the communication principles that you use every day in your practice. So it's taking time to listen, welcoming questions, don't be offended and don't offend. You know, I think sometimes it feels like having the witty or pithy response is like what feels good, but it's absolutely not what's going to help families change their minds, because you don't want to develop any conflict. You want to use science versus anecdote when you can. That you will find some families really respond well to anecdote, and if you think that's the case, then it is okay to use that. And then in the end, you want to respect the parental authority. The parents get to make this decision for their children, and it is you want to ensure ongoing communication, that this isn't a one-time conversation. This is something that you're going to continue to revisit over the course of your relationship. And then I think another big one on here is determining readiness for change. We talked about the vaccine hesitancy spectrum. And, you know, if there's a family who's in there who's like, I'm never going to vaccinate my child ever, then you kind of want to give them good information, and then you want to move on. You don't want to spend an hour in the room getting into this conflict of who's right and who's wrong. One thing that is really important to remember is beware of debunking myths. You want to identify that a myth is a myth, and you want to state that it's false, but you don't want to get into the weeds with families about, you don't want to go down the rabbit hole with them being like, oh, pull up that website for me, let's look at it together. That is not actually going to help you convince them that it is false. You want to focus on the corrective information, and you want to state it simply. So that's saying, vaccines don't cause autism, vaccines are safe for children, and then you move on. Where this came from is this study looked at the questions. They asked people, can the vaccine give you the flu? And if you look at the left, or you're right, sorry, no, you're left, I was right. The dark bars, those are people who weren't concerned about the flu. So it's low side effect concerns. So they weren't concerned about the flu vaccine. And they, a pretty low proportion of those said the vaccine can give you the flu, as compared to people who had high side effect concerns, where more of them said, oh, the vaccine can give you the flu. This is circled in red so that you pay attention to it. And the next slide, then they asked people, are you going to get the flu vaccine, after they gave them information? So the control information was information that's like a vaccine information sheet. That's like, oh, here's what the flu vaccine is, here's what the flu is, et cetera. The danger information was information that said, the flu influenza illness is dangerous, you should get the vaccine. And then the corrective information was all of the information about debunking myths. So it was like, here's all the reasons that the flu vaccine cannot give you the flu. And if you look at this, and then they ask people, are you going to get the flu vaccine? And the people who got the corrective information were much less likely to say that they would accept the flu vaccine later. So debunking a myth actually makes people kind of more entrenched in their belief. And that's based on a couple of different social psychology concepts, one of which is that when you repeat the information that you're hearing in the myth, it actually makes you like believe it more because you're saying it out loud. So people, I don't know if you remember when you would like study for exams, some people will use like talking about something to help learn it. And it's the same thing is true when they're talking about their myths that they've read. They're saying it to you, they're repeating it. It's helping them get sort of more firmly entrenched. And the other thing is that people will hear a myth and they may read it on this like debunking myths website, but then they forget where they read it. So they've heard it before. And if you're familiar with information and you hear it again, you're more likely to think that that information is true, even if the source that you read it, what you knew at the time, was not a valid source. So beware of debunking myths. So what does work? The first step is offering an effective provider recommendation. So that word effective is underlined. What does an effective recommendation look like? Anybody have any suggestions? Something they'll trust.
Yeah, what I would do with a mom who's an anti-vaxxer, I would give them some information that I have personally, that I personally took care of 2 unvaccinated kids, age 6 and age 8, who got measles and died. And I watched them every day in the process of dying. And then I also mentioned that here in the Tri-Cities, about 15 or 20 years ago, we had a mini epidemic of measles come through. And a 25-year-old unvaccinated lady died from measles here in the Tri-Cities.
Yeah, it's protecting kids from vaccine preventable diseases is really important, and that's why we're here talking today. So going on, like, what are they going to trust? So one of the first things is using a presumptive approach to vaccinating. So the presumptive approach to vaccinating is you walk into the room and you say, Johnny's due for their vaccines today, we should give them their vaccines. And that's different than the participatory approach, which is Johnny's due for their vaccines today. What do you want to do about vaccines? Because if you use it the second way and you say, what do you want to do about vaccines? Families are like, well, what do you mean? What do I want to do about vaccines? Are you not recommending it? Like, like, let me think about what these questions are, versus like assuming that they're going to get their vaccines. And that's true. That's not just when the provider goes in the room. That's across the whole clinic. Vaccination is a team sport. That means that your schedulers know when they need to come back for their vaccines. That means your MAs go in the room and are expecting to give vaccines. That means that you're not sort of bringing up this question of like, oh, should we do vaccines or not today? You're starting from the beginning of, we think we should do this. Strong is that same idea. Like, I think you should get vaccines. I think it is safe to get vaccines. I'm recommending this. Strong. Timely means that your child is due for this now. Let's do this now. Universal is you tell it to everybody needs their vaccines. Urgent is the sooner we can protect them, the better. And then bundled means you're offering all of the vaccines together. And the places where I think this falls down a lot are the ones where we see more hesitancy. So HPV is a great example. Flu is a great example. In the newborn nursery, I saw a lot of hepatitis B being unbundled. So what it means to bundle it is you say, we should give the Tdap, meningococcal, and HPV vaccines today, versus saying, let's give Tdap and meningococcal. What do you think about influenza? What do you think about HPV? So you want to put them all together as like, I am recommending this very strongly. And in the newborn nursery, what I see is I'll see like, oh, your child needs their vitamin K and their erythromycin. What do you want to do about Hep B? And so it sort of separates them when you should be lumping them. And then you want to pursue the initial recommendation if the parent resists. So if they say, okay, I have some questions about the HPV vaccine. great, you should address their concerns and answer their questions. But then in the end, you should say, and I'm recommending that we give it today because it is safe to give it to him today. It'll protect him as soon as possible from the diseases that we're protecting against. And then you want to ensure ongoing conversations. So for the families that are not accepting vaccines, you do want to make sure that they understand that you're going to keep talking about it, because like we talked about, vaccine hesitancy declines over time. And people's circumstances change over time. So we looked at the graph of the kindergartners who are going into, so going into school is a great time that families may be prompted to catch up on their vaccines, or if they have, an immune compromised family member now, or if there's other things that change in their lives that may prompt them to be more vaccine accepting on that day that you see them. Other communication strategies. The other evidence-based communication strategy that has been shown to improve vaccine acceptance is motivational interviewing. So motivational interviewing is something that I'm sure you all use all day, every day for a variety of different behavioral interventions. And what it does and how it works is that it reinforces a parent's own motivation for vaccine acceptance and their self-efficacy to do it. So like we said before, having somebody talk about all the reasons they don't want to do something makes them believe more firmly in that. The same thing is true for motivational interviewing when you identify what are the reasons that you do want to do this behavior that we're trying to get them to do. There's four main elements: empathy, collaboration, evocation, and support for autonomy. This isn't something that has to take a long time. There's a couple of brief tools that we're going to go through that can really sort of help you assess kind of where the patients are and try and get them to move towards vaccine acceptance. So one is the confidence ruler. Has anybody ever used this? Cool. I like it. So the question is, on a scale of 1 to 10, how important is it for you to vaccinate your child today? So let's say they say it's a 2. Then you said, okay, great. I hear that you think it's a 2 today. Can you tell me why it's a 2 and not a 1, or why is it a 2 and not a 0? So then you're having them tell you all of the positive things about vaccines and all the reasons that they would consider giving their child vaccines. And you can reinforce that. Like, oh, it's really great that you think keeping, Jane safe from the vaccine preventable diseases is important to you. It's important to me too. The safest way to do that and the most effective way to do that is to give them their vaccines. The second one that I like is the elicit, provide, elicit. So in this one, you elicit what the parent knows and understands. So you say, it sounds like you might have some questions or concerns about Emma getting her vaccines today. Would you mind sharing those with me? So then they tell you their concerns. Then this is the key critical part of this motivational interviewing, is that you ask them permission to provide new information or advice. So you say, oh, thanks for bringing up those concerns. Vaccines are something that I spent a lot of time learning about. Can I share some information that I found and why I think that they're important? When you ask people if you can share information, you seek permission to do it before you do it, they are more likely to be open and accepting of that information because they don't feel like you're, lecturing them or you're in this conflict because they've given you permission. Almost always people are going to say yes. And if they don't say yes, that means that they aren't interested in learning. So like you're going to save your time by not lecturing them today. And then you can say like, okay, hey, that's not something you want to talk about today. Just so you know, vaccines are really important to me. I'm going to bring this up again when you come back for a future visit. So just ensure that ongoing conversation. Yeah.
What do you do if you ask for permission to give them information? They say no, but then you still have either like declination forms that have to be signed, and technically you do need to address some of this stuff.
Yeah, so I think you can say, I hear that you're interested in learning more about vaccines for me today. If they want to sign a declination form today, then you say, to get this done today, then we are going to have to keep talking about it. But it kind of, I think it reframes it for you that like you're not going to convince them; they're just there to sign the declination form. But then it might be a time that you're like, or we can come back for another visit and talk about this at a different time if like now is not the time, but you do want to keep talking about this. Does that make sense? Because most of the time people decline vaccines. It's not necessarily related to the school form. It's like a longer term thing. You want to give information in a neutral, non-judgmental way as we were talking, and then you want to ask them what their response to that information was. So I'd love to know what you think about this information. Has it helped alleviate some of your concern? What else would you like to know? And then you want to, like with the previous technique where we talked about starting with the presumptive approach, you do want to end with a like, I'm still recommending these vaccines. Like it is still important to get these vaccines because having that second follow-up was associated with more vaccine acceptance versus a like presumptive approach. Parents said no, and everyone was like, okay, good, great, we're not going to do those today. some resources that are available. I don't know if anybody has looked at the CHOP, the Children's Hospital of Philadelphia vaccine education website, but it is very helpful and user-friendly. It has great information for providers. It addresses a lot of specific concerns. So if, for example, a family is really concerned about like a certain vaccine ingredients or something, it lists a lot of the common ones. You can like say like, oh, great, that one, you can look at what's in that one, or we can find a brand that doesn't have that thing that you're worried about. And then also the AAP and the CDC both have great information about conversations with vaccines with families. Yeah.
I found that if after I go through all the explanations and reasons and my personal experience, they still do not want vaccines for their child, I will ask them to go somewhere else. And I give them the reason. I says, because if you bring your unvaccinated child into my clinic and he is carrying something, he may infect one of the little babies in the waiting room who has not had all their immunizations. So your child becomes a health menace. That's the sledgehammer approach.
Yeah. And it's interesting because so the AAP actually changed their recommendations on that probably like between 5 and 10 years ago. They used to say like, pediatrician offices should accept everybody, and you should you should be open to vaccine hesitant families and children who are unvaccinated. And then about 5 or 10 years ago, they changed that and said if practices want to have practice-based policies that say we don't accept children who don't follow the CDC vaccine schedule, then that is like within the purview of the practice. And there's been some research on that out of Colorado. I think anecdotally what has happened is that a lot of families will just accept, like we'll just say like, well, I don't want to have to find another pediatrician, or I don't want to find another practitioner, so I'll just do the vaccines. So there are some that is going to catch some kids up and keep them up to date. I think one of like the flip side of that is that you will sort of drive the people who are more hesitant, maybe to providers who are kind of more accepting of the hesitancy. So there's probably there is some population that's just going to get up to date with it, and there's going to be some subpopulation that's going to go to practices that don't have those policies, which is going to overburden some providers with vaccine hesitant families, and also may drive them to more practitioners who are kind of more open to not vaccinating and creating clusters of under vaccinated. Other questions before we move on towards cases?
At the end of the discussion, when they say they still don't want vaccines, I say, okay, we'll talk about it next visit.
Exactly.
And instead of saying, okay, so you never want your kid to have this, I say, so you're wanting to wait longer? Because that puts the seed in their mind that it's okay for them to change their mind later. And it also says, I'm not making the presumption that you're going to say no forever. I just understand that you don't want it today.
Yeah, no, I really like that. I think that's a great way to frame it for families. And also it means that it helps them from getting kind of even more entrenched, and they're like, well, I said no, so I need to keep saying no. Idea. That's great. Okay. Too many shots and too soon. So one case is a parent that I've said I've heard too many vaccines get crammed in at once, and I don't understand, but I know that people are concerned about it, and I feel uneasy about how vaccines are grouped together. Has anybody heard this one? Yeah. I think, the first step of all of these is really like affirming that the parent cares for their child. Like what you always want to do with motivational interviewing and everything is you want to identify what is a commonality. Like you both are hoping to keep the child as safe as possible. That's like it sounds like you're worried about making the right decision for your child. Like I also want you to make the right decision for your child. You're worried about keeping your child safe. I also want to keep your child as safe as I can. You want to partner with them in that you're working towards the same goal. It's not a conflict over vaccines. One of the great things is vaccines are much more pure than they were in the past. So those of us who got vaccinated in the 80s, we got vaccines to 8 diseases and had over 3,000 immunogenic proteins, as compared to now where we do 14 diseases and about 150 immunogenic proteins. So they are definitely they're more targeted now than they had been previously. New vaccines are tested with vaccines to be given at the same time to ensure the safety and efficacy. That's the concomitant use requirement. Sometimes people know about this because of the COVID vaccine. I'm sure you all remember that when COVID vaccines first started, we had to separate them by everything by a month. And now we don't have to do that because of the concomitant use studies. So you can say to families like, oh, it's it's great that you're working, you want to make the right decision for your child. All of these vaccines are tested to be given together, and so that we know it's safe to give these vaccines together. Vaccines will not overwhelm the immune system. The immune system responds to much greater challenges all day, every day, and can respond to even greater response. So lots of reasons to give shots at the when they're due. The other thing I think is really important is to highlight to families that the schedule is based on both exposure. So when are kids likely to get exposed to vaccines? That's why we want to make sure we cover kids for pertussis and Hib and pneumococcal when they're infants, because that's when they're at the highest risk of getting severe disease. And then the other thing is that we want them to be able to develop an immune response to it. So that's why the MMR is timed for a year, because that's the time where the child's able to mount a lifelong immune response to it, as compared to giving it younger, like we do for travel vaccines, but then they don't develop the same long-term immune response. Alternative schedules. Has anybody ever been asked for an alternative schedule? Yeah, so it's very common to be asked for an alternative schedule. They've done several studies where they look at vaccine delivery data from insurance billing and looked at all the different patterns. And there's lots of alternate schedules. A lot of them are just some made up pattern that doesn't have a real pattern to it. It's very common, particularly in Washington State, to have parents request an alternative schedule. Some people are comfortable offering an alternative schedule. I think that we did some interviews of families of children who were hospitalized and behind on their vaccines. And what was interesting to me was there was several parents who were like, oh, we're doing an alternative schedule. And they perceived that their provider was just fine with it. And it wasn't a problem. And it was sort of typical. And they felt like everybody was doing this. And I do think that it is our responsibility to sort of recommend the CDC schedule for all the reasons that we said, because it protects kids as soon as possible from diseases that can cause them morbidity and mortality. And it also helps them develop the immune responses as soon as they're able. And HPV is a great example of that, where getting an immune response to HPV sooner actually provides better long-term immunity than compared to getting it at 13 to 15. And then there's a lot of variability in alternate schedules, as I'm sure none of you all are surprised by. So what do you say to families? So I think you want to figure out why they want an alternative schedule. Is it because cousin Susie recommended it? Is it because they're worried about the previous question about too many vaccines at once? Is there some reason for it? And then you want to explain that the schedule, it's great that you're working the same thing before. You want to partner with them. It's great that you're thinking about how best to protect your child. I recommend the CDC schedule because we've studied it to know that it's the best way to protect your child against diseases that they could be exposed to, and that could be really severe based on their age. There's no evidence regarding harm of the current schedule. I think we've all had families that swear they're going to come in once a week, every week for the next 6 weeks to get their vaccines. And then they do it twice. And they're like, oh, actually, it's very inconvenient to do this. And it costs a lot of time and effort. And they're going to stop doing that. So I think, recognizing that it's a burden to keep coming in and giving them all now is going to be the safest, most effective way of getting them the vaccines that they need. And then my favorite study is they measure the cortisol response in infants who received 1 shot versus getting the 3 shots. And then they found that the cortisol response was the same. So it is just as stressful for your baby to get all of these shots at the same time as it is for them to just get 1. And getting 1 once a week, every week for the next month is actually more stressful for them than just getting them at least 1 time. I think that's sort of obvious when you think about a 2-year-old. If it's a 2-year-old, every time they come into the doctor and they think they're going to get shots, they're traumatized by it. And not that babies are traumatized the same way as a 2-year-old is, but it is stressful for them to get them. And so doing it all at the same time actually is more, it's lower stress than spreading them out over time. Ooh, nobody has these diseases anymore. I think we have a great story of how that's not true. And I think it's, in some ways, COVID helped us with this because people kind of realize that the world is a global community and things spread more easily than you want. So I think it's important to acknowledge that parents' beliefs are shaped by their experiences. Vaccines work so well that they've been a victim of their own success, and we aren't seeing polio and diphtheria the same way people did see it before the vaccines were available. There are ones that are common and are in our community that it's important to protect against. Examples are pertussis or influenza. There's tons of reemergences of, measles, like you mentioned. There was a mumps outbreak here a few years ago. There was a Disneyland measles outbreak, 8 to 10 years ago. That was big. And then there was a diphtheria outbreak in Bangladesh, in 2018. So knowing that we live in a global community, diseases don't care about the borders. Children are still susceptible to these diseases, and all of them are very serious. Okay, I don't want to give my kid COVID's a great example of this. I don't want to give my kid the COVID shot because they want them to get their natural immunity. Same for varicella. Anybody heard this? Is natural immunity better? I like the shrug. Yeah, I don't know either. I think one way you can validate their care for their child is you can appreciate that they're thinking about how to best protect your child. Natural immunity may be better in some cases, but vaccine immunity is good enough, and it doesn't have all of those risks of all the subsequent complications that you can get. So, for example, like MIS-C and COVID, or the sclerosing subacute panencephalitis and measles, shingles and varicella. There's lots of reasons to prevent the initial infection that are more long-term than just this infection. Vaccine immunity is studied to provide good enough immunity to prevent infection. Like I said, natural infections may cause greater immune response, but they can also lead to a lot more complications. So you're getting more risk without significant benefit. Okay, if my child is sick, why would I want to challenge their immune system by giving them vaccines? Even if they're cold, I don't want them to feel worse. Okay, what's the problem with this is that children are sick for their first 5 years of life, right? So you would never give any vaccines ever if you waited till a kid was completely well. So the Advisory Committee on Immunization Practices, they recommend giving vaccines if a child has mild to moderate illness, but then does a very poor job of describing what mild to moderate illness is. So I think that this is one that can be tricky, but most of the time it is safe to give vaccines, even if a child has mild to moderate illness. So recognizing that the parent, I understand that you don't want Johnny to feel worse when they're already feeling sick. I understand that they're already feeling kind of tired and crummy. All of the studies show that the antibody response and the risk of adverse events is the same for kids who have mild to moderate illness as compared to healthy children. So you can say they're not more likely to have more side effects because they already have a cold or have an ear infection. Then you can say, they're in daycare, so they're probably going to have a cold for the next 6 months. And so leaving them unprotected for that time is not the best choice. It's not the best idea for them right now because they're going to get all of these things. Ear infections are a great example because, a lot of the vaccines we give can prevent ear infections. So it's saying oh, I hear they have an ear infection now and you don't want them to feel more miserable, but these vaccines can prevent a subsequent ear infection. So getting them as soon as possible could be helpful for him. They don't make the illness worse or put them at risk for other infections while they are sick. And it prevents them from having to come back. So we all know how that works so well. And then this is a really important thing. Vaccinating at sick or acute care visits is a really key strategy to improve vaccination coverage. So that's all about decreasing our missed opportunities. So every time a child who is under vaccinated or missing a vaccine comes into the clinic and doesn't get that vaccine, or comes into the hospital and sees me and doesn't get that vaccine, that's a missed opportunity. And that's a time where we could have taken advantage of the fact that they are in a healthcare setting and they are seeing us. When I think about this mild to moderate illness question, I think about kids who are hospitalized, when they're coming in and they're on continuous albuterol in the emergency room, it's probably not the right time to give them their shot, but when they're 4Q4 and leaving, that's the perfect opportunity because they're here, it's safe. It's going to prevent them from having to worry about that later. Has anybody ever had any concerns about vaccine ingredients? There's a lot of concerns about vaccine ingredients. I think you want to address the specific ones that the parents have questions about. So the thimerosal is a big one, formaldehyde, aluminum are kind of common ones. Thimerosal, for those who may remember, is a mercury-containing preservative that used to be in routine vaccinations up until 2001. There was a lot of outcry about that and the concern for association with neuropsych conditions. There was no actual evidence that showed that it was related to neuropsych conditions, but because of the sort of public outcry and concern about it, it actually was removed from all pediatric vaccines except for multi-dose flu vaccines. So if a family has a concern about this, you can say, great, not in any of our routine vaccines. There's preservative-free influenza vaccines that probably most of you all have because you give it to young children as well as pregnant women. So you can offer them that, and then the thimerosal should not be an issue. But families don't know this, right? Because they read somewhere that like, oh, this is a bad ingredient and we can't have it. Aluminum is another one that is in some vaccines. It's used as an adjuvant. So an adjuvant is used in inactivated vaccines as a way for the vaccine to say like, hey, I'm something foreign, you should react to me, as a way to reduce the number of antigens in that vaccine. It's a really small amount of aluminum. It's less than breast milk, less than formula. So it's less than they're going to get exposed to just from their general life. So it's a safe amount of aluminum. And then other ones are gelatin, which is used in MMR as a stabilizer, as well as there are some vaccines that were developed in fetal cell materials. So there is some people are concerned about the religious aspects of those things. All of the leading scholars and religious leaders have all said like the benefits of vaccines outweigh the negative of these things. So all kind of organized religions still do recommend vaccines. And so if families bring this up as a concern, I think there's a lot of community organizations that have leadership from religious leaders that promote vaccines. And so accessing those and connecting those with families can be helpful. Do vaccines cause autism?
Wait, I have a question from the Zoom. Do you ever have parents that are more against the method of giving the vaccine versus the substance itself, like not as aspirating back on the syringe and injecting into veins/arteries?
Oh, less commonly. I mean, I think I would highlight that same reinforcing that they are worried about, they want to keep their child as safe as possible. You want this to be as well done as possible. I think in most clinics, like the MAs and the people delivering vaccines do this like all day, every day. So I think I would highlight their experience. And, the family can certainly be in the room and observe the vaccine, et cetera. I think you do want to be realistic about side effects, like having local side effects are the most common side effects. So their arm may be sore, they may get a bruise, you can get a large local reaction to a vaccine where it gets red. Particularly with the COVID vaccine, I think the Moderna one was causing that a lot initially. So saying like those side effects are possible, and so you may have pain and redness at the injection site. You can say that can happen no matter how it's getting injected, and these are people who are very skilled at doing this. Okay, we only have 10 more minutes, so we will do one more case and then we can pause and see what other questions there are. Okay, vaccines and autism. Obviously, this is a huge concern that has been very hard to convince people otherwise. Vaccines do not cause autism. They've studied millions of children to show that vaccines do not cause autism. It's really a communication failure, and it's hard to unscare people. Has anybody read this Lancet study? Oh, great, thanks. Yeah, so the Lancet study is like, it's hard to believe that this was published in such a reputable journal. It was been retracted. Wakefield has lost his medical license. It was fabricated data, so it was a bad study that was false. And families actually people don't know that. Like sometimes people are really surprised to hear that. They've showed now millions of children and shown no association between vaccine or vaccine ingredients and autism. Unfortunately, Wakefield is still an active person who goes to communities and perpetuates this myth, particularly in Somali American communities in Minnesota. So there's been many measles outbreaks in that undervaccinated group. So I think this is something that I don't know how we undo, but I think we continue to don't debunk the myth and tell them the factual information that vaccines do not cause autism. It's safe to give vaccines. There's more and more research that shows that autism can be diagnosed like very early, particularly before any kid gets any vaccine. So the idea that like autism gets diagnosed after a year, most of those kids are having symptoms before that are not being picked up. Online information. So parents look for information online, period. Only about 50% in all of the studies of online and social media information, only about 50% of parents talk to their provider about what they are reading online. And this is a problem because people kind of can have an agenda or can have a question they don't want to bring up with their doctor. We did some interviews with parents, and one of the parents said to me, well, you don't want to bring it up because then you get the physician eye roll. And like, that's absolutely like not what we want to do, or we don't want to, like, we know they're looking at it. We want them to have open communication with us. We want to be able to address the questions that they have, and we want to build that relationship, because otherwise we know that they're getting that information from somewhere. It's difficult to identify trusted sources of information. This is where sometimes that personal anecdotes can be helpful. So, I'm also a parent, and I definitely understand it's 2 a.m. and you want to find something out. And the easiest way to do it is to like look at the internet. So the way you can do that is you really want to look at trusted resources. So the AAP has great ones, not only about immunizations, but healthychildren.org is one that I recommend to like all the families I see, because it's got a lot of really detailed information. We've already mentioned that Children's Hospital of Philadelphia, Vaccine Education Center, the CDC, Voices for Vaccines has a lot. Voices for Vaccines has like videos with personal anecdotes, which can be really helpful if that's one that you think is going to resonate with families. All right, we got through all of it. What questions do y'all have?
So I'm an RN who works with immunizations and specifically in refugee populations. I get a lot of concern from clients about medical safety because they've developed a mistrust in medical system because of circumstances or how they were talked to about their health. So how do you go about addressing or kind of undoing the damage that's been done by prior experiences by the time they reach you at this point in their immigration process?
Totally. I mean, I think you want to, validate that experience that they've had because it's real. There's certainly medical mismanagement, not only in other countries, also here, and particularly for disadvantaged communities. So you want to say like, oh, it sounds like you've had really hard experiences, and I understand that you're trying to do what's safest for yourself and what's safest for your child. And I think that's when you can then, reflect on your experience. So you can, as a nurse who cares for a lot of families, we do provide a lot of vaccines for children. And, I really believe that it is safe to give vaccines in these vaccines that we're giving to your child. And, that's a great time where an anecdote can be helpful, like where you, like if you have children, if you have family members, if you have people who are close to you, who you've recommended vaccines for, you've supported with the vaccines, I think, say like, I do this for my children because I really think that it's the best way to keep them safe. Where you're really using the elicit, provide elicit, you want to ask them if it's okay for you to share more information. And that's how I would start in this, like in the conversation you're having with them. If it's a bigger community that's having concerns about it, then, in Seattle, there's a really active Somali American community with leaders that are really proponents of MMR vaccines, and there's resources through there. So then I think the next thing is, where do you trust to get information from? Like who do you trust to get information from for your health, and then trying to partner with some of those people.
I'm sort of intrigued by the question about Googling things, right? Because the residents and medical students that I work with often Google to find out answers to questions.
Yeah.
And their answers are generally reliable and evidence-based. So these systems, like if I Google all the time from my computer, Google learns what I really am looking for, right? Has anybody looked at whether like the parent who says, she Googled something and she's reporting that to you, that she gets a different body of information than I do when I Google it?
Oh, they definitely do with Google.
Pardon?
Yeah. Yeah, Google definitely does that. It does specific based on like what you've Googled before.
But has anybody looked at that and sort of
like
used that
studied it?
evidence to say? But do you know of evidence? I mean, has somebody studied that? I mean, I guess this makes sense too, but I never thought about that until you said this.
No great authority here, but as somebody who Googles things, if I'm looking at a red pillow, for my couch, all of a sudden ads come for red pillows. If you Google things in the hesitant direction or you like something, then it feeds you more of the same. That's called confirmation bias. And it's a problem with criminal justice, is a thing with marketing. It's everything. Whatever you think a little bit about, it just reinforces what you know, and you don't see two sides of an issue, which is why it's just so important to teach parents the reliable sources to go to.
Yeah.
Because I do think, yeah, for sure, the social media as a source of information just magnifies people's existing opinions.
It's
And-
true. It's true. And they've done studies of like looking at internet information to say like what are good, valid, reliable sources. And the ones that tend to be more reliable than others are organizational and like governmental. So, you know, talking to people early about what are reliable resources and saying, you know, like, oh, Mayo Clinic has a great website. You know, Seattle Children's has a great website. Healthcare organizations, and then places like the CDC, the American Academy of Pediatrics, healthychildren.org. Like these are places that are going to tend to have good answers to your questions. So I'd recommend if you're going to start looking for answers online, like start looking for those, and like, you know, putting those into your after visit summaries, like for your newborn visit, because you know that people are going to start looking for that early on. And once you go down the rabbit hole, it's hard to get out of the rabbit hole. So that's like what you're talking about, where, you know, you get this confirmation bias from going down these different tools. And, you know, social media is really interesting because there is power in that, and there's positive things about it, right? So like social media can help people develop a community when they have, you know, medically complex kids or other things. There's reasons that people go and seek support through that. But I think, you know, really trying to teach people early that, you know, be careful where you end up on the internet, because there's a lot of different places, and trying to stick with the places that you know are reliable is important. Yeah. Exactly. Yeah. Yeah. Mhm. Mhm. Yeah. And I think keeping them open, that they know that they can talk to you about it, is a really important thing.
Oh, sorry. So what I was saying is that I don't spend a lot of time arguing with people. If they already come in with an attitude and I have information that's important for them, I always I tell them where to look. I tell them, look, there's an awful lot of information on the internet that's not accurate. I'm not going to tell you where to look, but I will tell you where it's reliable. And the few ones that I know about, I tell them the Mayo Clinic, ask Google, you know, whatever question, and make sure it comes up with the Mayo Clinic or NIH. That's always very, very good, informative information that's at a level that they can understand. That's important because I think we forget that we're the only ones that speak medicalese. I think it's important that we figure out how to talk to our patients in the language that they understand. And not only, it's important when we deal with people that are from other countries and they speak other languages, we get a lot further in providing information that's important to us if we speak their language. I don't know how we can fix that, but it is important.
Yeah, that's true. The AAP healthychildren.org website is also in Spanish. And then the Washington State Department of Health has a lot of different vaccine resources in like a variety of languages, so that there are things available in other languages if you have patients who are non-English or Spanish speaking.
One question that I frequently ask is, do you know how vaccines work? Most of them haven't the foggiest idea. Number one. Second, you're being vaccinated primarily for a virus. Do you realize that viruses do not make themselves? They have to invade a cell, force that cell to make more virus. And your body doesn't like that. And so the immunization gives you a head start at providing the protection that you need for those viruses that want to take advantage of your cells. And if oftentimes it's very simple, doing a little bit of drawing to show what happens and what is happening and why. And then do your look online and we'll talk about it. In other words, education is one aspect of medicine that we need to take advantage of. And most of us are capable of doing that. And to do it in a very gentle manner, acknowledging, I understand how you feel. I felt that way too before I realized what's going on. Let me show you.
I don't really have a question, but personally, I'm a medical assistant and I work with pediatrics a lot with Dr. Baxter. And I'll tell you, I'm not trying to make parents sound like they're lower in intelligence, but a lot of them just really don't have a clue sometimes. And you need to go out and you need to ask them straight up, well, where did you find this information? And I did recently have a couple of parents with a newborn, and they were completely against vaccines. And I asked them, well, where did you get your information? And then they started spouting off, social media sites, YouTube, places like that. It always helps to make sure you ask them, where are you getting your information? And say, well, I asked them, actually, I said to them, well, do you really believe everything you hear on YouTube? Every little thing, aliens, UFOs, whatever. And they're looking up this immunization stuff on there. And we all know how YouTube is. It isn't always true. And once you start to actually get down to their level and talk to them about it and say, hey, where are you getting your information from? And prove to, or, point out to them that it's really not reliable. They're more apt to come and turn over and say, oh yeah, okay, well, I'll look at this website you offer them.
Yeah.
But that's just my personal experience.
Yeah.
And I've had a lot of parents switch sides with vaccinations and other things that they've seen on Google with colds and, viruses and bacteria and stuff. So I just wanted to say that.
Yeah, no, that's great. I think that's a great example of how, vaccination is a team sport. Like I said before, having everybody in the clinic and who all the people that they're seeing get on board, because it will resonate. Like there'll be somebody who clicks with them and who will say, and the families will say like, oh, I should think more about this. I should read more about this. Giving them the valid sources of information, like you said, Mayo Clinic or other places, can be really helpful, particularly in the newborns, because they are looking, it's all new for them.
There's a comment on Zoom that historyofvaccines.org is another online resource that they give to parents.
Great.
I don't know if people remember, but he just reminded me, this community or the Native American community has a long history of mistrust with government. And it's very painful. I have a hard time speaking about it because it's hard to argue with their experience and then you trying to get this important message across to them when the memory of their pain is so prominent. So I think this is another opportunity where we can learn how to communicate better. And a lot of how we do things speaks a lot louder than all this flapping of our jaws. Sorry.
No, and I think that's a really, as I said before, I think validating that their experience is real and has been bad for them is really important in building trust. And there's some great, like within REACH and the Immunization Action Coalition are both organizations within Washington that have worked a lot with Native communities towards improving vaccination rates to help build that with people in the communities to build that trust.
And just an additional comment about the populations that I work with. I really like that you bring that up because it is very challenging sometimes, especially when they're sharing these experiences, because on a personal level, I understand that there's a lot of history of mistrust, and it's sometimes very difficult to kind of explain when so much damage has been done from an external point of view. But what I will say about this population is they're very resilient. I think because of the nature of immigration and our process in it, oftentimes we are able to kind of not reprimand, but repair some of that trust. And even if we can't get vaccines as the first step, I think just the continuity of care, at least in our system, has been a very rewarding part of our work. And I think our community is very good at having some pretty good representation. Myself am bilingual, and I do find that speaking a common language or having some level of connection to the client makes a big difference in their reception to the information that you're giving them.
Totally. And like you said, that's a reason to continue ongoing conversations, because it may not be today they trust you enough, but they may build that trust. Oh, the other thing that Kendon had asked about was the RSV vaccine, well, I'm calling it a vaccine, it's not really a vaccine, that's coming out hopefully anytime now. So there's the new monoclonal antibody that is currently recommended by the CDC for every child up to 8 months for their first year of RSV, and then for a second season for children who are high risk. From what I've heard is that the Department of Health is like working on how to get it paid for and get it distributed. So hopefully that will be something that becomes available to our patients this fall. And I think, there'll be a lot of places where it is going to be recommended, particularly the newborn nursery and these young children who may be coming in for like their first flu vaccine. So it's probably worth starting to talk about with some of your families, because they're probably reading about it and they may have questions. And it's a monoclonal antibody. It's similar to the old Synagis, which we gave to really high risk patients, but you only have to give it once because it lasts for 5 months. And it is pretty effective at preventing hospitalizations. And as we all lived through last November, if we can not have last November happen again, I think that will be good for everybody in our communities. Yeah. Cool. Great. Thank you all so much for your attention.